Hello, we are dental students from Al-Azhar University, Gaza, and in this assignment, we are going to talk about an important oral health indicator in Basel, which is the DMFT index, and how it used to assess the dental care situation there. Before we start, we would like to introduce our group members. My name is Farah KHOZONDAR, and I am working on this assignment together with my colleagues, FATHIA, Elhout, SHAWAREB, and ASAIDY. We reviewed the research article, understood its content, and prepared this assignment together. Before we move into the details of the study, it's important to clarify what DMFT actually means, since it's the main concept used in the research. Okay, so DMFT is a well-known index used worldwide to measure dental care experience, especially in children. It stands for D for decayed teeth, M for missing teeth due to caries, F for fell teeth. So basically, it tells us how many teeth were affected by dental caries in terms of decay, tooth loss, or fillings. A higher DMFT value indicates poorer oral health, while a lower value means better oral health and fewer dental problems. For this assignment, we searched for a suitable research article using PubMed, which is a trusted medical and dental database. We focused on studies from Basel that used the DMFT index, and we selected an article that examines DMFT specifically among 12 years old school children because this age group is commonly used to represent national oral health. In the next part of the assignment, we will talk about the article we selected, its purposes, how the study was done, and the main outcomes related to DMFT and Basel.
The article we selected for our assignment is titled Decline in Dental Caries Among 12 Years Old Brazilian School Children Between 1980 and 2005. It was published in the International Dental Journal in 2012, which is a well-known scientific journal in dentistry. The research was carried out by a group of Brazilian researchers who specialize in oral public health. The study is peer-reviewed, so it is scientifically reliable and trusted. The main aim of the study was to evaluate dental caries among 12 years old children in Brazil and to see how the level of dental caries changed over a long period of time, from 1980 to 2005. Now, if you ask what makes this study special, I can answer you is that it doesn't just focus on one single year. Instead, it follows the change in oral health for many years. Here we are talking about 25 years. So, it clearly shows whether the situation improved or not. In terms of methodology, the researchers used national oral health survey data from different regions across Brazil. All the children included were 12 years old, which is an important age group commonly used by the World Health Organization to assess children's oral health, because most permanent teeth have already erupted at this age. The researchers then measured the DMFT index for these children in different years and compared the results to understand the overall trend in oral health in Brazil.
Hi, I am SHAWAREB. Now I will talk about the result of the study. After analyzing the data, the researcher found a clear and significant decline in DMFT value among 12-year-old Brazilian children during the study period. This means that the children had fewer decayed, missing and five teeth compared to the best, which shows noticeable improvement in their oral health. This improvement did not happen randomly. One of the main reasons was the implementation of national oral health program in Brazil, which helped increases awareness about oral hygiene and encouraged healthier dental habits. Another very important factor was water fluoridation, along with the widespread use of fluoridated toothpaste, which played a key role in reducing dental caries. Also, access to dental care is improved over the year. So more children were able to visit dentists, uh, receive treatment, and defined from preventive care. In, in addition, better living conditions and higher health awareness help improve oral hygiene practices. Overall, the study showed that Brazil made strong progress in reducing dental caries among school children, which is considered a positive public health public health achievement. However, that the research the researchers also mentioned that this improvement was not equal in all regions, and children in poor area still had higher DMFT level compared to this in richer area.
Hello, my name is Aya Al Saidi. Even though there was a clear importance in oral health overall, the researchers found that the importance was not equal across all regions in Brazil. Some regions, especially the more developed and wealthier areas, showed much better results and lower DMFT values. However, children living in poorer or less developed regions still had higher levels of dental caries. This shows that social and economic factors still play a very important role in oral health. Access to dental care, education awareness, and living conditions can strongly influence children's oral health status. In the discussions, the researchers emphasizes that importance of public health strategies and preventive programs. They highlighted that measures such as fluoridations, health education, and improving access to dental services can lead to real positive changes in oral health. At the same time, they stressed the need to continue monitoring oral health and to focus more on disadvantaged area to reduce inequalities between different regions. In conclusion, the study showed that Brazil was successful in significantly reducing dental caries among 12-year-old children between 1980 and 2005. However, there is still work needed to ensure that all regions benefit equally and that every child has the chance of the enjoy good oral health. Thank you for listening.